Hi, I'm Roland. I'm Deputy Medical Director here at Portsmouth Hospitals and a respiratory consultant by background. I have spoken to you before at times when we have been challenged by the busyness of the hospital and the local health system. It is another one of those times, I'm afraid. We have been seeing very high attendances at our emergency department, and amongst those high attendances a lot of very sick people. This has been continuing throughout September and October, and despite a huge amount of work by ourselves and all of our community colleagues, the hospital is overfull, with very, very little space for us to see new patients in our emergency department. Having put a lot of work into trying to improve the situation and keep things as safe as we can, we decided that we needed to declare a critical incident because the safety of our patients, the well-being of our patients and our workforce were at significant risk due to this sustained pressure. How can you help us at this time? As I said, there are a lot of sick people around in our communities at the moment, and many of those people will need our help. But for them to have any space at all for us to see them in the emergency department, we need people who have problems that do not need to be seen within an emergency department to look at alternative ways of getting information and advice. Obviously, top of the list for advice would be 111, either a call or the online service. Your local GP and primary care service is also another really important team for you to lean upon at this time. We also have the option of going to urgent treatment centres for minor injuries and ailments, and pharmacies are increasingly providing support again for minor illnesses and ailments, and they're a very valuable resource that you should think of turning to. So this is a message just to let you know we are under immense pressure at the hospital. We and our community colleagues are working incredibly hard to try and make sure that we can deliver safe and consistent care for our patients. But we have had to go into critical incident because of sustained significant pressure, and if there's anything you can do to help us by looking at alternatives to attending the emergency department where it is safe and appropriate for you to do so, please do so. Finally, a request: if you have loved ones in our hospital at the present time, we need to get people home in a timely way when they are better, and any assistance that you can give us with actually supporting their transport home, facilitating their getting home by providing clothes, making sure that they have their fridge stocked up when they go home, that they have the clothes they need to travel home, would be immensely helpful, and all would play a significant role in us trying to decompress the hospital, support people to get home safely, and provide safer care for the community. Thank you so much.